digital Congress will be attempting at least to recreate the same scenario that we have had in the in-person sessions and editions. Therefore, I think that, as always, the most attractive part of the Congress, especially in terms of the innovation and the educational aspects, are related to the guidelines that are published and that are new. And the other aspect are the hotlines that are the clinical trials that are relevant and published every year and presented at the ESC Congress. So in terms of the guidelines that we have this year, I think that one of the most awaited and interesting are the one related to the atrial fibrillation new guidelines that will incorporate several new aspects, especially concerning the two aspects of the management, one related to the anticoagulation therapies in the patient that, as we know, with the new oral anticoagulant have had an extensive change and reorganization. And the second one relates the ablation and the modality of ablations and the different approaches that have been developing over the years will have a new focus and a very strong impact on the applications. I think that the other aspects that we would like to highlight are the clinical trials that will be presented. Of course, at this time, we don't have the results and we don't really know exactly, what will be the impact because we have not seen the results. But several studies, both in the field of the ischemic heart disease, and in particular related to the approach, pharmacological approach and comparison with different approaches will be presented. I think that for our audience, it will be particularly interesting. As always, there is a big attendance on the aspect of the guidelines in practice, and in particular, the guidelines that have been presented last year that now are seen under the perspective of the challenge of the application in the clinics. And in particular, we will have sessions related to severe aortic regurgitation and how, the new guidelines guide the therapy and the treatment for these patients, where we know there is a fine balance between the need of surgery, whether the conventional medical therapy. And also, we will have guidelines in practice sessions for the patients with angina and with and without coronary artery disease. We know that especially with the trials that will be also discussed, because we will have a presentation on some of the results of the ischemia trial that have been already published, but now secondary studies are coming out. And as we know, the ischemia trial has questioned the application of the therapy, the revascularization therapy in this subgroup of patients. And therefore, will be very interesting to see to which extent also, the management of the patients with angina after these trials will be changed and modified to the current practice that has seen the revascularization as a critical strategy. And now maybe we will have to reconsider, at least in some group of patients, what should be done in this specific condition. The interesting aspects that I would like to highlight is that for these very special sessions, the one dedicated to the new guidelines, the guideline in practice, and the hotlines with the trials, we will have not the classical version of slides, PowerPoint presentation with voiceover, but we will really have live sessions with also especially the discussion of both how the guidelines will be practice changing and really the results of the new trials as well as the discussion will be done with live sessions that will start every day at 2 o'clock. So the Congress has a portion where we have mainly the abstract sessions that will be with slides and presentations with voiceover, and the physicians will be able to select the one that they want to attend. But there will also be a part of the program that will have a true live discussion. And so we hope that with this, we will be able not only to create a very interactive environment, but also we will be able to allow the audience to send questions through chat and then receiving responses by the presenter. Or also we will create some focus group online through chat system, so that there will be the possibility of discussing among participants, replicating a little bit what are the discussion about the person who come at the meeting, and then a lot to discuss the new results and the new aspects. So we hope that this possibility of having some level of interactivity will be a strong addition to the Congress for this year digital edition.